Hi, I'm Wade Norwood, CEO of Common Ground Health, and I'm delighted to be with you for this special presentation brought to you by the University of Rochester Medical Center, Center for Community Health and Prevention. Our aim is that through this presentation, you'll learn more about how regional COVID-19 vaccination efforts are addressing social and socioeconomic inequity, and how questions about the vaccine are being answered to promote equitable uptake of the safe and effective COVID vaccines. As you may know, Common Ground Health is the health planning entity for our 9-county Finger Lakes region. We see it as our mission to bring focus to the region's health issues through our research, data, and analytics, our community engagement, and through the partnerships that we enjoy with so many of the change makers in our community. As a result, we're proud of our partnership with the Center for Community Health and Prevention. And I'm personally grateful for the leadership of its director, Dr. Nana Bennett, who has helped us bring together a broad base of over 60 different partners that in January of 2021, launched the Finger Lakes COVID-19 Vaccine Task Force. At times over the last year, we're meeting almost daily to ensure equity, transparency, and efficiency in COVID-19 immunization efforts, with the goal of vaccinating at least 70% of the eligible residents in Genesee, Livingston, Monroe, Ontario, Orleans, Seneca, Wayne, Wyoming, and Yates counties. It's truly been a regional effort because COVID has had an impact on the entirety of our region. And this impact has been disparate. Rates of COVID have been higher for African Americans and Latinos with regard to COVID incidents, hospitalizations, and sadly deaths. And with over 750,000 of our fellow Americans dead from this disease to date, this has had a profound impact on the health of our nation, our community, and our families. The life expectancy inequity gap by race is now the largest it's been since 1998. Latino males have experienced the biggest decline in life expectancy with a drop of 3.7 years. And the coronavirus has been responsible for 90% of this decline among our nation's Latino community. You should know that we have organized our work here in the Finger Lakes region around the insight we've gained from national survey work that was conducted by the National Ad Council. Their work has helped us understand that within our community, we all came into this calendar year with different perspectives on the vaccine and on the vaccination effort. It's great that some of us were immediately ready and eager to be vaccinated, but some were resistant. And most of us were where I was, seeking protection from the pandemic, but worried about a brand new vaccine and looking for information and support at the start of a journey towards saying yes to the vaccine. I'm glad I've made that journey, and I am so very blessed that I and all of my household, my family, and almost all of my friends have been vaccinated. But in order to ensure equitable uptake of the vaccine, I and my colleagues on the task force acted on this insight from the Ad Council and on the wisdom of what's called the second law of healthcare improvement, that when in doubt, consult the experts. And we knew that the experts are the people themselves. So we went and we consulted with the experts. We listened to our neighbors, to folks who live in our community who are similarly journeying towards yes. And we asked them to help us understand the barriers that are in their way. And through over 250 interviews with our neighbors, folks from across the region, we came to understand that we had three major barriers as a task force to confront. Locating the opportunities to be vaccinated closer to where people live, work, play, and pray. Overcoming the barriers that cost always presents to healthcare access, and helping people navigate the morass of information and talk about the virus and the vaccines. One of the successes we've had as a result of the partnerships that are the task force has been our ability to move beyond the incredible work that was done through the large community vaccination sites at the Dome Arena, at the Convention Center, and at the FEMA Hawkeye site. Sites that were vaccinating hundreds of people each day, to now do the incredible work that's being done at places like MCC's downtown campus, the Monroe County Fleet Center, and at special pop-up locations like Frontier Field, the Vineyard, and in many city neighborhood community centers, libraries, and churches. These efforts have all been strengthened by door-to-door appeals that were made by hundreds of volunteers, including community health workers, the City of Rochester, and the Black Agenda Group and La Cumbre. ABVI Goodwill's 211 helped many callers make appointments, and this service is still available and can be accessed through the Monroe County COVID hotline, 753-5555. Our local hospitals and clinics have been reaching out to their eligible patients, and the Rochester City School District, the Interdenominational Health Ministry Coalition, and the County of Monroe have been making robocalls to the community, as numerous community-based organizations have been personally outreaching to the people that they serve in order to support them on their journeys to saying yes to the vaccine. Friends, through all these efforts and more, we've been able to host over 350 unique vaccine clinics at 82 different locations. Our local transit service has been an invaluable partner in this work, in making sure that transportation has not been a barrier to these neighborhood-based opportunities. And without a doubt, all of this hard work has paid off. The City of Rochester's R centers and branch libraries have been the cornerstone of this work. And for that, I thank the city government and city staff. And I'm excited by the opportunities that are now being opened up by the leadership of the Monroe County Executive and the Monroe County Public Health Department, as they have launched a mobile vaccination effort that will bring this work even closer to the community. You see, we're building on the work to date by literally taking it to the streets. We've hired and deployed 30 folks from the community who, since the 1st of April, have been out in the community, meeting one-on-one or in small groups, having table talks. And these vaccine ambassadors have reached nearly 15,000 individuals through these conversations and events. While at the same time, we've had dozens of volunteer trusted experts who have reached hundreds more through more than 40 speaking engagements that have been organized through the Task Force's Speakers Bureau. And all of this work has been done while also making clear that in addition to being safe and effective, The COVID vaccines and booster shots are all free. You don't need to have insurance. And if you have to miss work to get vaccinated or to deal with any vaccine side effects, here in New York State, you're entitled to paid time off from work. And from now until November 23rd, Monroe County residents 12 years or older can get a $50 or $100 gift card when they get their first vaccine dose. The generous support of our local business community, the United Way, the Community Foundation, the ESL Foundation, and their partners in philanthropy have made all of this hard work possible. And this hard work has made a difference. It supports our You Deserve Answers web-based tools, through which we're able to provide folks who have questions, concerns, or information needs with the help and resources that can support their journey to yes. We continue to update these tools so that they remain timely and responsive to the questions that people have. Questions that deserve answers. You know, when this task force began its work, it set for itself the goal of achieving equity as we pursued the larger goal of vaccinating at least 70% of our eligible community members. We are moving well towards achieving both of those goals. No, it hasn't been easy. And far too many of our neighbors, friends, and loved ones have passed away as part of the sad toll levied by this global pandemic. The economic disruptions, the families and households whose lives have been turned upside down are also a part of this story, because health and wellness extend beyond the clinical into the community, into how our schools, workplaces, and neighborhoods are impacted. But friends, through it all, something good has happened. As a community, we have come together. Partnerships have been built and partnerships have been strengthened. And we have all come to the place where we place the right value on. We've come to a place where we've learned how to center the importance of togetherness, of family, of being on one accord, of life. We've learned the wisdom of Helen Keller, that although the world is full of suffering, it is also full of the overcoming of it. Thank you for listening to our community story, and thank you for the gift of your time.